always be caring. In our ABC web series, our today's presenter is Nilanjana Maulik. With a master's degree in sociology, human services and dementia studies, and a national awardee, Best Dementia Care Worker, Nilanjana is presently the National Coordinator, Alzheimer's and Related Disorders Society of India, ARDSI, and Secretary General of ARDSI, Kolkata Chapter. She is an international master practitioner of Spark of Life philosophy from Dementia Care International, Australia, and a master trainer of dementia care skills from Alzheimer's Disease International, London. It is Nilanjana's relentless search to improve the life of persons with dementia and their families and to elevate dementia care in India that motivates her being. In Always Be Caring, we present Nilanjana Maulik.
Thank you very much, ABC, for giving me this opportunity to talk about an overview of dementia. Dementia, as you may be aware, is a complex health problem, both because of the sheer number of the underlying conditions that can cause it, and because of its direct and indirect impact on people and the health system. Having represented the cause since 1994, I have personally seen the tremendous change in terms of the numbers affected by the condition, the socio-psychological status of those experiencing it and living with it, and the response of the community as a whole towards this condition. So if I were to give you all a brief intro to the global status of dementia, do note that the world today sees around 50 million people living with it, and every 3 seconds, someone, somewhere in this world is getting a diagnosis of dementia. So we have on an average 10 million cases per year. And out of this number, nearly 60% live in the developing countries like ours. Out of the 10 top countries in the world, China leads, followed by USA and then India. This is stated by the World Alzheimer's Report 2015. The scary part is that this number will almost double every 20 years, reaching 82 million in 2030 and 152 million in 2050. Hence, if dementia was a country, it would be the world's 18th largest economy in the world. However, in this 18th largest economy, there are some alarming facts. Number one, up to 3/4 of those with dementia worldwide have not received a diagnosis. Number two, almost 80% of the general public in it are concerned about developing dementia at some point in their lives. Number three is 1 in 4 people think that there is nothing we can do to prevent dementia. Next is that 62% of healthcare practitioners worldwide incorrectly think that dementia is part of normal aging, which it is not. Not all elderly develop dementia. Finally, you must know that globally over 50% of caregivers who care for their loved ones with dementia say that their health has suffered as a result of their caregiving responsibilities over a period of time. So no doubt, World Health Organization recognizes dementia as a public health priority, and in 2017, it they endorsed the Global Action Plan on Dementia. And this plan basically provides a comprehensive blueprint for action for policymakers, for international and national regional partners to start addressing dementia as a public health priority. The reason is basically to tackle the epidemic. The Global Action Plan on Dementia, as I mentioned earlier, provides a blueprint for action to tackle the epidemic in certain focused areas like awareness building, risk reduction, strategies for good care practices, improving diagnostic tools, discover best treatment and care pathways, deliver effective support services, and finally, more and more research. In India, however, the understanding about dementia is inadequate. I still see people joking about memory lapses, and there is a lack of financial investment into the cause as well as shortage of human resources who deliver care. There are also no appropriate tools for screening the population in early phase of dementia. This is because of the large diversity of our country in terms of its language and its culture. If I come to appropriate and inadequate services and programs for those affected with the condition, there's a huge gap. Only 10 daycare centers, 15 residential care centers, and about 100 memory clinics for a country of 143 million elderly population. And this is mostly run by government and private hospitals and some by ARDSI, the organization that I represent. There are also huge gaps in research, especially of good longitudinal studies, which can provide true trend of the disease and determine risk factors. There's also dearth of information on economic cost and social burden of dementia in the Indian population. But being a country of diverse ethnicity and culture, it has great advantages to carry out large studies. Finally, as I said, there is lack of health policies from the government. Therefore, to tackle the epidemic effectively, we need to take every step to improve awareness regarding all aspects of dementia and to halt the epidemic, thereby contributing to a healthy nation. We can also begin by addressing both the risk and protective factors of dementia. We can promote primary prevention of dementia by universal screening for risk factors for all age groups, beginning from younger population to old age. And to do this effectively, we need to empower the healthcare workers and professionals in screening and management of dementia. Considering the increasing dependency ratio, the caregiver burden is going to be huge. And so more and more dementia respite center, residential care centers, training and counseling should be introduced to support the caregiving community. Basically, an effective healthcare model should be developed to deliver the services to families and people living with dementia. And the research on dementia should be considered as a high priority by the government, and it should focus both on the clinical and non-clinical aspect of dementia. So as dementia epidemic is going to be an inevitable thing due to ongoing demographic transition, we as an organization like ours have already presented a document to the Union Ministry of Health, Government of India, called the Dementia India Report, and a dementia strategy to educate, inform, and motivate the government to act positively. And this dedicated national policy on dementia will enable a national dementia registry, early diagnostic clinics in every district across India, and it will mobilize social support to meet the needs of people with dementia in their own homes and within their communities. And finally, training professional caregivers to shoulder the care along with the family. Finally, last but not the least, what we look forward is a significant increase in GDP spending on health and education in upcoming years to halt the epidemic of dementia. That is all from my side on this topic. Thank you so much.